Record again. Okay, here we go. Oh, let me hide these floating meeting controls. Select the incorrect statement. The massage business should maintain hand washing facilities with hot and cold temperature controls. Incorrect statement. The massage therapist is usually allowed to work without a valid massage license, but only if she or he is a current member of a professional massage therapy association. It is good practice to keep lubricants in labeled contamination-proof containers. Massage clinics should ensure that they clearly indicate fire exits with signs. Incorrect statement. It should really stand out to you.
A massage therapist is usually allowed to work without a valid massage license.
That's right. Which of the following is not considered a biological hazard? Fungi, like fungus, insect bites, extreme heat or coldness, body fluids, which is not a biological hazard.
Extreme heat or coldness.
It doesn't say where the insect bites are. Are they on you or are they on the client? Like, is your client gonna get bit in the facility? It's a poorly worded question. Let's assume the insect bites are on you and see what happens. Like you went outside and got a bunch of mosquito bites and now you're at work. Is that a biological hazard?
No.
No. Let's try that. Not correct. Not correct.
Extreme heat and cold.
No, it's got to be extreme heat and cold is a biological hazard, right? Oh, maybe not biological. Ah, look at that. Ah, all right. Physical hazard, not biological. Interesting. Why is it important for massage therapists to obtain material safety data sheets, MSDS, on all products used? To identify whether the product can potentially irritate the skin or other parts of the body, to be made aware of necessary measures and first aid procedures to perform on the client if necessary, to have knowledge of how to properly store and dispose of the product, all of the above. I think all of the above, right?
All the above?
Yeah, I think so.
Mhm.
Let's see. Okay. I'm going to scan the questions and see. Okay, yeah, these are good questions, but I don't want to spend the whole session just on these.
Okay.
Okay, now I don't know if these are going to be relevant on the MBLEx. I don't know if these are going to be on the MBLEx. Let's go through just like, oh, I see. There's only about 10 or 12 of them. Let's go through the following 10 or 12 statements, and then we'll move on to some like kinesiology or massage applications or anatomy. The study of disease as it is exhibited biologically and physically is called infection, medical terminology, hygiene, or pathology. The study of disease as it is exhibited biologically and physically.
Not infection, not hygiene, terminology.
Pathology, yeah. Usually the study, by the way, the study usually has OGY, OG. Biology, zoology, pathology, yeah. A branch of medicine concerning the cause, origin, and nature of disease. Blank is defined, excuse me one second. Blank is defined as the death of living cells, while blank is the abnormal uncontrolled growth of cells. So right away, do you know which one is the abnormal uncontrolled growth of cells?
Well, it's-
Okay,
No.
that's all right. So death of cells, neoplasm, while uncontrolled growth of cells is cancer. Death of cells, necrosis, neoplasm is the uncontrolled growth of cells, neoplasia. Autopsy and tumor, that doesn't make sense. Pathology and necrosis also doesn't make sense. It's either one or two.
I'm gonna go
Which
with
one is it?
I'm gonna go with number one.
Okay, a neoplasm is a growth on the body, and that is not the death of living cells.
So
Right,
no.
cancer is the uncontrolled growth of cells, so 50% of this number one is correct, which they did just to confuse you. It's necrosis, necrosis and neoplasia. Neoplasia is the uncontrolled abnormal growth of cells or tissues in the body. The abnormal growth itself is called a neoplasm. So neoplasm is defined as the death of living cells would not be a correct statement. Necrosis, the death of living cells, is a correct statement. Okay, next. Which of the statements below is false? Pathologists examine the cellular pattern of tissue samples to determine whether a sample is cancerous or non-cancerous. They're asking you what type of scientist, what type of medical professional. Pathologists examine the cellular pattern of tissue samples to determine whether a sample is cancerous or non-cancerous. Areas of study in pathology include cellular injury adaptation, wound healing, and inflammation. Pathology, areas of study in pathology. How would we know that as massage therapists? How do we know that? Gross tissue analysis is the examination of tissue under a microscope. I don't think gross tissue, you don't get gross from looking through a microscope. Surgical pathology can either be macroscopic or microscopic. This is not a good question for us, I think. Let's try to answer it. Which one is false? Let's try this one. That's correct. Macroscopic analysis involves gross tissue analysis, which is the examination of tissue with the naked eye. I don't think that's going to be on the exam. Blank involves the examination of sampled whole tissues under the microscope. The examination of sampled whole tissues under the microscope. The examination thereof. So is it grossing, histology, biopsy, or macroscopic analysis?
I'm gonna go number four, macroscopic analysis.
Okay, that's incorrect. I think it's probably biopsy or histology. It's histology. Yeah. Okay. Blank involves freezing the tissues and cutting thin sections of the tissue for analysis. Is that the frozen section process, chemical fixation, performing a biopsy, or none of the above? Did you have anything resembling pathology and histology in your studies?
Say it again?
Did you have anything resembling this question in your studies?
No.
No, me either. Let's try performing a biopsy. Okay, no, frozen section process. Yeah, so frozen section process is freezing tissue and cutting a thin section for tissue analysis.
Okay.
When pathology involves examination of the whole body to determine the cause of death, it is called an autopsy.
Mhm.
Cytopathology refers to the study of inflammation, the study and diagnosis of diseases on the cellular level, the study of diseases and conditions of the brain, diagnosis of diseases at the molecular level. Cytopathology. I'll say study and diagnosis of disease on the cellular level. Yeah, so cyto, like cytoplasm, cell, which is the cellular, the fluid inside the cells. So that's, I got it just from the reference to the word cyto. Select the incorrect statement. Cancer is caused by genetic mutations or alterations of a person's genetic code. Molecular pathology allows for the detection of very small tumors that are otherwise undetectable by other means. Direct transmission of an infectious disease can occur via inhalation of pathogens. Parasites are organisms that need a host to survive. Let's just pick number 1. Incorrect. Yeah, transmission of a disease can occur through direct or indirect physical contact. Ingestion and inhalations are modes of indirect physical contact. Good to know. Let's see how many more of these. Blank refers to the diagnosis of disease using laboratory analysis of blood and other body fluids, tissues, and individual cells. I believe that is hematology. Nope. Let's try laboratory testing. Nope. Chemical pathology. Yeah. Which branches of medicine concerning the study of blood, the blood-forming organs, and blood diseases? That's, I believe it's hematology. Yeah, it is hematology. Blank involves the analysis of bodily fluids for diagnostic and therapeutic purposes. Let's see, let's say body fluids for diagnostic and therapeutic purposes. I don't know. Let's try immunology. Pathology. Yeah. Chemical pathology. In which of the following cases can a medical professional use the ethical right of therapeutic privilege? When the medical professional fears that patients suffering from depression may commit suicide, if the patient makes a conscious, informed statement that they don't want to know the entire truth, if the medical professional believes a patient would rather be lied to than told a horrible truth, if the medical professional is treating a child or an elderly patient. Oh, this is a new section. Let's just go with ethical right of therapeutic privilege. Let's try 1, 2, and 4, or 1 and 2 only. Yeah. Ethics refers to the principles of morally right and good conduct. Professional ethics in massage therapy is the application of guiding principles of right conduct, of study, practice, and business for massage therapy. In medical ethics, therapeutic privilege, also known as therapeutic non-disclosure, is defined as the withholding of relevant health information from the patient if non-disclosure is believed to be in the best interest of the patient. Okay, let's exit out of the like legal, ethical, safety stuff. And let's go with, why don't you pick a starting point? You want to do you want to start with the integumentary system, like skin? Or would you like to do shoulder and arm, forearm and hand, head, neck, and face, spine and thorax, pelvis, thigh, leg, and foot, or therapeutic massage applications, or benefits and physiological effects of techniques that manipulate soft tissues?
I'll save that one.
This one? Okay.
Oh.
You want to do something else?
Yeah, let's do the spine and thorax.
Spine and thorax, okay. Oh, it's just this needs to be reset. Okay, all of the following muscles are firing during flexion of the concentric contraction of the head and neck, except for concentric contraction of the head and neck, except for the anterior scalenes, the upper trapezius, the longus colli capitis, or the SCMs. So why is the answer upper trapezius?
Because in a flex, confirming flex.
That's right, because a concentric contraction for the neck is going into flexion. The definition of concentric, like con or with, is two bones together. So that'd be like the cranium and the thorax are coming together, right? And eccentric would be bringing them up into neutral, away from each other. Okay. Hopefully these aren't all selected. Let's do this on the, instead of doing it here, let's do it on, what's the name of that section? Yeah, sometimes it acts like this. Sorry, spine and thorax. Let's do it over here instead, because it'll just be easier. Oh, there's a study guide for spine and thorax. That means I thought that there were some things that were a little tricky. Let's just look at these like later. Oh, these are great anatomy drawings. Let's look at those another time if we don't have success answering the question. Yeah, here we go. Upper trapezius. Okay, next question. A teenage client receives a summer scholarship to study ballet at, sorry, I guess I don't know what I'm doing, to study ballet at Boston University. She was informed by the scout that she needs to work on her turnout. She has tried different things to improve her turnout for a few months with no success. Of the following techniques, which would help educate your client of the possible misuse of neuromuscular activity that causes improper turnout? So how do you educate this client on the proper use of turnout? Would it be Alexander technique, active isolated stretching, acupressure, or AMA? Which one do you think?
I forgot what Alexander technique is.
Okay, let's go to the answer and the explanation. So the answer is Alexander technique. The Alexander technique promotes education in movement to improve posture and adjust conditioned patterns of movements. And I think that's enough. Let's look at the other definitions. AMA is a traditional Chinese medicine deep massage, which works with meridians. Acupressure is TCM, traditional Chinese medicine finger or knuckle pressure, working along the meridians. Active isolated stretching is athletic stretching method used to lengthen muscles and release the fascia. There will be more questions like that. An increase of blood flow through the capillaries delivers what to the tissue cells? What does it deliver? Metabolic waste to the cells, oxygen and nutrients to the cells, hormones to the cells, intercellular fluid to the cells.
Oxygen and
blood flow. I think so, yes. Oxygen and nutrients. What body system provides a mechanical barrier to pathogens that aid in the lymphatic immune response system? Is it the integumentary system, the muscular system? Oh, I don't have an unanswered. No. Is it the integumentary system, muscular system, digestive or skeletal system that provides a mechanical barrier to pathogens that aids in the lymphatic immune response? It's the integumentary system. The skin's keratinized epithelium provides a mechanical barrier to pathogens. The acid pH of the skin's secretions inhibit the growth of bacteria. You are contacted by a potential client by phone. She would like an explanation of how you would help to lessen the pain level in her right shoulder upon rotation. She tried another massage therapist, but only obtained a small amount of relief with Swedish relaxation application. Which of the following modalities could you utilize in your explanation of treatment possibilities to activate the body's natural healing abilities? To activate the body's natural healing abilities. That should tell you right away what answer you're looking for. Active isolated stretching, Aspen patterning, Alexander technique, or acupressure.
Alexander technique.
To activate the body's natural healing abilities. Alexander technique works with posture and movement.
Acupuncture.
Acupressure, yes.
Oh, acupressure, sorry.
Yes, yes, and they give you this long explanation about which points you would press, but whatever. Okay, active isolated stretching is athletic stretching method used to lengthen muscles and release the fascia. Aston patterning includes massage, movement education, fitness training, postural evaluation, and environmental modifications. So if you had a question about the ballet dancer who needed to work on their turnout, if you have Aston patterning and Alexander technique in both of those, it's going to be a tough call. But Aston patterning was not one of them. They both involve movement. They both involve movement. Acupressure involves activating the body's natural healing abilities. Active isolated stretching involves lengthening the muscles and releasing the fascia. Where do the inferior and superior vena cava meet? Ooh. Inferior and superior vena cava. Okay, do they meet at the cusp or the right atrium or the interatrial septum or the aortic semilunar valve? Okay, we know they don't meet whatever this cusp is. Those are veins that go to the what?
Cusp.
Inferior and superior vena cava. They go to the heart. Remember? Do you remember if they're on the right or left side? Or no?
Yes. The right is I forgot.
Okay. Okay. So the heart. Okay. So the inferior vena cava, can you see? Okay. And the superior vena cava. Here's the inferior vena cava and the superior vena cava. They both go into the upper chamber on the right side of the heart. What's the upper chamber called? The atrium or the ventricle?
The upper. Oh, wait, say it again. I'm sorry.
What's the name of the upper chamber of the heart? Is it the atrium
Yes.
or is it the ventricle? It's the atrium. That's right. That's right. Good. So they go into the right atrium. There we go. The right atrium. Ding, ding, ding. Which of the following physiological effects is a reflexive component of cross-fiber friction? Reflexive component of cross-fiber friction. Is it that it relaxes muscles and decreases hypertonicity? Is temporary ischemia a reflexive component of cross-fiber friction? Broadens and stretches muscle tissue, decrease in fascial adhesions. Which one is a reflexive component of cross-fiber friction?
Decreases. And so, decrease in fascia adhesive.
It's relaxes muscles and decreases hypertonicity. So so let's see if we can. Yeah. So there's a difference between mechanical effects, or I think they're sometimes called direct effects, and reflexive effects. So let me see if I can. I don't have an explanation from these materials, so I'm like deducing or making up what I think these effects are. So linear, like a straight line, or a circular, like a round. Friction mechanical effects. Broaden and stretches the muscle tissue, temporary ischemia. Decrease in fascial adhesions, increases muscle extensibility, breaks up and reforms scar tissue. Those are, I would say, a direct result of cross-fiber friction. Like they're what are happening right away in the area where you're doing cross-fiber friction. Reflexive effects happen as a response of the body's response, as a result of the body responding to what you're doing locally. So an increase in blood flow is not a direct response, it's a reflexive response, right? Let's see, hyperemia which is secondary to ischemia. So temporary ischemia is swelling, right? That'd be a direct result of cross fiber friction. Swelling can be a direct result of cross fiber friction, right? But hyperemia, let me just get a good definition of that. Hyperemia, an excess of blood in the vessels supplying an organ or other part of the body versus ischemia. And ischemia is, inadequate blood supply to an organ, especially the heart muscle. Yeah, okay, I'm sorry. So ischemia, sorry. All right. Ischemia, like inadequate blood, like evacuating the blood from an area, is a direct result of cross fiber friction. But then an increase in blood flow would be secondary to ischemia. That's a reflexive effect. And the muscles relaxing, they're calling that a reflexive effect as well. Whereas stretching muscle tissue would be a direct effect. Broadening the muscle tissue, decreasing fascial adhesions would be increasing muscle extensibility, breaking up and reforming scar tissue. That would be a direct effect. And a reflex would be relaxing the muscles. Decreasing hypertonicity by the nervous system or done on a tendon or Golgi organ and increase in circulation, those are also reflexive. So maybe you think of reflexive as happening later and think of linear or direct effects or mechanical effects as happening immediately. And mechanical effects are local, like right where you're working, and reflexive effects are systemic and local. Like the body has to send the blood from the whole body to the area for hyperemia to occur. Is anything confusing? Is anything I said confusing?
No, it ain't confusing.
Okay. Okay. All right. Where are the superior facets located on the vertebrae? Are they on the lamina groove, the body, the transverse processes, or are they on the spinous process? You're already going, So let's take a look at them. So here's a facet, right? Looks like this has a dens on it. So I'm thinking this is the C2 vertebrae. So here's the facet. And where is the facet? Is it on the body or is it on the transverse process? Let's say this is the body here where I'm circling. And that this whole thing is a transverse process. Can you see that the
process?
The transverse process, that's right. Let's look at it at another vertebrae. Here's the thoracic vertebrae. Okay, here it's not labeled. This is the facet right here. That's the facet. This is the facet. That's the facet. Facet. Facets. See? Right? Is that on the transverse process or is it on the body?
Transverse process, right?
Yeah. Or is it on the spinous process? Not on the spinous process, right? Good. Oh, or is it in the lamina groove? The lamina groove, right in here. Is it in the lamina groove? No, it's not. Lamina groove, body, transverse process, spinous process.
Okay.
And imagine I was wrong. I went through all that and I was wrong. It has happened. Transverse process. The spleen is a hollow organ, a smooth muscle, part of the digestive tract, or a solid organ. Is it hollow or solid, the spleen?
Solid.
Let's give it a try.
Solid?
Solid, yeah. Yeah. Solid. The pathology pes planus is also known as pronated foot and flat foot. What is the definition a contracture or thickening of the IT band, a decrease in the medial longitudinal arch, and a pronated hindfoot, inflammation and pain at the lateral femoral condyle and IT band juncture, a painful degenerative change to the articular cartilage on the underside of the patella. Ooh. Pronated foot and flat foot. There could be only one correct answer here. Okay, what body area are we talking about? Read the question for me and tell me what body area we're talking about.
The pathology, his planus
Mhm.
is also known as pronated foot, also the foot, the flat foot.
Yeah, yeah. Where is the IT band located? What part of the body?
Down the IT band is down the leg, right?
Yeah, be more specific.
On the hip.
Okay, that's specific enough. Yeah, it's on the hip and it's on the lateral surface of the upper leg or lateral surface of the thigh. Yeah. Okay, so notice that number 1 mentions the IT band, number 2 mentions the IT band, and then number 3 mentions the underside of the knee. So it's not going to be 1, 3, or 4. It's not going to be A, C, or D. It's going to be decrease in medial longitudinal arch. Do you know where the longitudinal arch and the hindfoot are located?
Longitudinal arch. Longitudinal arch. Is it right under the foot?
It is from the heel to the toes, the longitudinal arch.
Guess where the arch is at in your foot, yeah.
Yes, yes. There are actually three arches. Here's a pretty good drawing. So here's the longitudinal arch, medial arch. There's the lateral arch, so that's on the side of the foot, I think, and then there's the transverse arch that goes across. That's not. I'm sorry, that's not a good drawing. See, I'm wrong. Let's try this one. Yeah, the arches, the 3 arches of the foot. So I would say that this one here goes across. That's the transverse arch, right? You see this one here, transverse arch, right? And then there's 2 arches on one arch on the inside. That's the longitudinal arch. And then one on the outside would be the lateral arch. Medial longitudinal arch, lateral longitudinal arch. I can't get the, there we go.
Yeah, is okay.
Yeah. That's a good drawing to have around. Okay. Yeah, longitudinal arch and pronated hindfoot. And the hindfoot, you know where the hindfoot is?
No, hindfoot.
Okay. Hindfoot, midfoot, and forefoot.
Oh, okay, yeah, we talked about that last week.
Yeah, good. Yeah. So the hindfoot includes the talus calcaneus and its connections to the fibula and the tibia, and then the midfoot is the cuneiform bones, and the forefoot includes the metatarsals and the phalanges. Okay, if you had asked me on paper if the metatarsals were part of the forefoot or the midfoot, I would have said midfoot, because I think of the metatarsal tarsal joint, tarsal metatarsal joint as being the the midfoot, but actually it's wrong. Wrong, Kinsu. Relaxing muscles and decreasing hypertonicity, or HT, is a reflexive, here we go, reflexive effect of what type of treatment technique? Relaxing muscles and decreasing hypertonicity. You know what hypertonicity is?
When the muscle is like
When it's what?
decreasing hypertensity.
Hypertonicity. Okay, so hyper means what? Too much or not enough?
Too much.
Yeah, and tonicity or tonicity probably means the tone of the muscle.
So too much activity in the muscle?
Too much tension, too much tone.
Okay.
Yeah. Reflexive effect, or something that happens as a result of a technique later, not immediately, not locally, but also systemically later. Reflexive effect of what type of treatment technique? Jostling or shaking, heat rub friction, Swedish gymnastics, or coarse vibration. Let's just pick one. We're going to have to go through a bunch of these for them to be clear. And these are really helpful because they're very clarifying.
Okay.
Heat rub friction has one mechanical direct effect. That's that it heats the skin and warms the tissues. It has several reflexive effects, among them that it decreases hypertonicity because of the warmth.
Okay.
Again, these are all in this document here in the drive that I shared with you, so you can go over them again. An acceleration, deceleration, soft tissue injury to the head and neck is the cause of, so that's going really quickly and then suddenly stopping. Acceleration, deceleration, soft tissue injury to the head and neck is the cause of,
Whiplash.
like, whiplash. Whiplash. Yeah. What hormones from the endocrine system influence the cardiovascular system? What hormones from the endocrine system influence the cardiovascular system? Is it epinephrine, ANP and ADH, all of the above, or thyroxine?
ADH.
ADH is anti-diuretic hormone. It causes the body to hold back water so that it stays hydrated.
So one.
I would say it's most likely epinephrine, yeah. Oh, we are incorrect. Okay, good learning moment. Epinephrine, atrial natriuretic peptide, and anti-diuretic hormone. Oh, vascular, cardiovascular. That's why. Let's look up the function of atrial natriuretic. Natriuretic. Is that how you spell it? Let's see. Atrial natriuretic peptide. Let me hear you say that twice.
Natural.
Atrial natriuretic. Natriuretic.
Atrial natriuretic.
Peptide. Nice. Try it again.
Atrial natrial peptidic. What?
Mm.
Atrial
If you
natriuretic peptide.
Yes. Yes. You know, if you mess up the first and the last part of a word or phrase, everybody knows what you're talking about. Right? But if you mess up the middle one, no, like everybody still knows what you're talking about as long as you get the first and the last, the beginning and the end. But if you mess up the beginning or the end, people are always confused.
Okay.
So atrial natriuretic peptide acts to reduce plasma volume by at least 3 mechanisms. It reduces renal, that's kidney excretion of salt and water, vasodilation, that's the opening of the blood vessels, and increased vascular permeability. That means the blood vessels and arteries reabsorb fluids or can let fluids out. Okay, so, and then anti-diuretic hormone. Anti-diuretic hormone. ADH, anti-diuretic hormone. Oh, I didn't know this. It's produced in the brain. That must mean the pituitary gland. Causes the kidneys to release less water, which decreases the amount of urine produced. So if there's more water in the body, What happens to the blood volume? Does it go up or down?
Or water goes up.
That's right. So it does affect the cardiovascular system, right? ANP, atrial natriuretic peptide, which controls the vasodilation and the absorptive capacity. No, let me use the exact words. The permeability of the vasculature, and ADH, which controls the blood volume and the fluid volume in the body. So it's all of the above. That's really good. Really good one. What is the name of the modality that helps to relieve pain and dysfunction by alleviating the underlying cause and utilizing soft tissue manipulation to balance the body's central nervous system? Is it myofascial release, neuromuscular therapy, polarity therapy, or orthopedic massage?
Myofascia? No. The neuromuscular therapy?
Yes. Are you? Yes. Yes. Good. Neuromuscular therapy manipulates soft tissues to balance the body's central nervous system. This comprehensive program is based on the neurological laws that explain how the central nervous system initiates and maintains pain. Practitioner's goal is to help relieve pain and dysfunction by alleviating the underlying cause. Which of the following is a Chinese modality that facilitates healing by regulating the circulation of qi and blood, that controls body functions and enhances resistance to disease by utilizing over 365 hand techniques? Chinese modality regulating qi and blood. Is it Heller work? Tuina? Watsu? You know what Watsu is?
Watsu? No.
It's shiatsu done in the water.
Oh, I was gonna say it sounds like okay.
Yeah, but
Watsu.
it's not Chinese. Or qigong. Qigong is usually movement, although some people will say that it includes massage, but classically it doesn't.
So a Chinese
The answer is
modality.
yeah.
Watsu?
No.
Is
Tuina. Tuina. Tui means to push and na means to lift and squeeze. Is a Chinese modality that facilitates healing by regulating the circulation of blood and qi, that controls body functions and enhances resistance to disease and utilizes over 365 hand techniques. So you just have to, there's a couple things that you know you got to remember about Tuina. Tuina is Chinese in origin. It works on the principle of qi and blood. It works on more than that, but that's one of the principles. And it has over 365 hand techniques, but it's like, yeah.
So you said Watsu is not Chinese modality?
Not Chinese, not Chinese.
Okay.
Watsu. Aquatic bodywork therapy. Where did Watsu originate? Oh no, look. Yeah, it combines shiatsu among others.
Shiatsu, okay.
Yeah. And then qigong is movement. They often call it moving meditation.
Mm-hmm.
But people do qigong in hospital beds too. You can do it sitting, laying down. Okay, last question. This structure is normally between tendons and bones and is made up of membranous flat sacs lined with synovium. You should know this. Is it the menisci, bursa, cruciate, or collateral?
Between tendon, okay, we know the tendon and the bone made up of membranes. So no. I'm gonna go with the last one. Collateral?
Collateral, okay, that's a ligament.
Oh.
The correct answer is bursa. So let's look at the location of the bursa. Yeah, so see if I can find like a good They're showing like a lot of knee bursa. Yeah, all right. That's pretty good. Oh, it's what? Wait. Sorry. So in the knee, for example, now they're showing this above the tendon, but I believe the bursa would be under the tendon and in front of the bone. Let's see what this one says. Okay, so this is showing that the bursa is between. Oh, okay, yeah, they're showing that there's a tendon that goes over the kneecap, right?
Mhm.
And under the tendon, there's a bursa, which they're not showing very well, and they're just showing it inflamed here.
So the
Let me get you
bursa
like
is in front of the patella.
the bursa is supposed to be, yes, it's in front of the patella, but it's also in front of the shin bone,
Okay.
right? And let's take a look at the anatomy of the bursa. The bursa is a small fluid-filled sac with lubricating fluid present in joints of the body. They're usually found in the synovial joints. So synovial joints are joints like the knee, the hip, the shoulder, the elbow. They secrete synovial fluid to lubricate it, compared to the joints of compared to the I forget what they're called, cartilaginous joints, the ones in the skull, for example. We'll go over that next time. Between tendons and bones, there are over 160 bursa present in the human body. So they're usually in between the tendons and the bones. Okay, so when they're showing a drawing like this, they're showing a sac on the outside and they're showing a sac on the inside.
Okay.
It's safe to assume that the sac on the inside is a bursa. And I think you also can assume that the sac on the outside is a bursa, but has a tendon covering it that's not shown. That's what I think. I don't think bursa are ever outside of tendons. Are bursa ever outside tendons? Okay, Johns Hopkins says the major bursae are near the large joints, shoulders, elbows. Yeah. Located next to the tendons, near the shoulders, elbows, hips, and knees. Okay.
Hips.
Okay.
Okay.
Take a look at the location of the bursa for the next time, and also the difference between the types of joints, synovial joints, and there's another joint. I'll find that for you next time. For next time, okay?
Sounds good. Well, thank you so much.
You're welcome. I'll let you know when the videos are up. Oh, here we go. Synarthrotic joints are the ones in the skull, and then there's like amphiarthrotic, slightly movable, and then diarthrotic. We'll go over those again.
Okay.
All right. Have a great night.
All right. You too. I'll see you Monday.
All right. We'll see you soon.
Pumpkin.